I think we're recording and okay. Hello, everyone. Welcome to another presentation from Diversity in Dentistry. Today we have Dr. Mohanta. She's with us and talking about her experiences, and we are going through all the questions with her as always to get to know her better and see what advice she has for all the pre-dental students. So hello, doctor. How are you today?
Good. Thank you, Ruspe. Thank you, Liz. And I'm so excited to be here. And I'd like to thank the audience for joining in, because even though I'll be talking a lot about myself, really, this presentation is all about you and about figuring out, from my experience, what path you would like to take, and to also think about your own diversity and that diversity of the patients we'll be seeing.
Awesome. Great. So with that, we'll start our first questions with Liz.
Okay, so our first question in this Family Feud style edition is a simple background of where you completed your undergraduate degree and what you studied.
Okay. I did my undergrad degree at the University of Waterloo.
Yay.
And I studied biology, and I had no intention of being a dentist. I actually wanted to be a university professor. So my whole undergrad degree was planned around that. I was a teaching assistant. I did an undergraduate thesis, and it was during my fourth year, during my undergraduate thesis, that I realized I hated research. So last minute, I went to the guidance counselor at Waterloo and said, what can I do with a biology degree? And she's like, well, the DAT is going to be written soon. And I'm like, I don't even know what that is. But the application was coming up. So I quickly applied, and, I just spent like a few days, preparing for it and practicing on my soap. And luckily I did really well on the DAT. Luckily I had all the requirements to get in. I only applied to 2 schools, Waterloo and Toronto and Western. And luckily I got into both of them. So I was an unlikely dental student. I'm so glad that I got into dentistry, because it is the perfect career. And if I didn't go into dentistry, just think about my options. I applied to a master's program. One was working on neurobiology of lobsters.
Wow. Interesting.
Other was at the Metro Toronto Zoo, trying to increase the population of black-footed ferrets.
Oh, wow.
I said goodbye to ferrets and lobsters and went into tea. And I'm
Wow. That's a really interesting story. Wow, cool. So did you ever consider applying to other professions as well in healthcare, such as like medicine or anything else?
When I was in high school, my mom really pushed me into medicine. So I thought, let me volunteer at my local hospital, which I did in the pediatrics department, because I love kids. Mm-hmm. And then that's when I realized that medicine's not for me. These poor kids were so sick. Some of them had terminal illness. Like, my job was fun. I was supposed to play with the kids, but I used to go home devastated. I still think about those kids today and wonder if they're alive.
Oh, wow.
So I knew that I just didn't have the mental fortitude to deal with, telling a parent their child is gravely ill or about to die. Mm-hmm. So that's when I totally switched gears and thought about, going to academia instead of health professions.
Wow, that was really interesting story. Well, I agree as well. Medicine is definitely a lot of patient interaction and just like dentistry, but also with certain type of conditions, and it can be really difficult to manage them both mentally, and it takes a significant toll on us. So I guess our second question is, why did you choose dentistry? And you sort of alluded into it, but I can imagine your counselor, when they said apply to DAT and consider dentistry, you should have probably done a bit of research as well and then written that. So what went into your mind at that time that you said, I want to
Well, I actually had no choice, because I was doing research on crickets, and I thought I do not want to have a career dealing with insects. And when the counselor opened the drawer, there was only one thing in it, and that was the application for the DAT.
Oh,
It was really all happenstance.
oh, nice, nice. And I think, yeah, and it worked out really well. I mean, you've been
Good.
having a really good profession, so that's amazing.
And as a follow-up, could you share what your experience in dental school was like?
I hated it. Just seriously, it was brutal. I would say it was the worst 4 years of my life. Afterwards, I had nightmares about it, thinking that I didn't graduate and they would call me back. I had PTSD. It took me 15 years to step foot at the faculty again. And so those early years after dental school were tough, but dental school was also tough. Like I felt like I didn't fit in. I wasn't smart enough. Everyone else dreamed of being a dentist. Meanwhile, I got in last minute. I was slow to pick up clinical skills. So I just felt like maybe dentistry wasn't the right career for me. Mm-hmm. But after saying all that, I would love to go back. I would do all 4 years again. I would pay for it again, because the reason why I had a horrible dental school experience is because of me, because I had a bad attitude, because I never asked any questions. Imagine, I spent thousands of dollars, 4 years of my time. I was surrounded by experts. These are people paid to help me, and I was so intimidated that I didn't ask for help. Mm-hmm. And so it all came back to, perspective, my attitude. I should have had a growth mindset, thinking this is all new. I've never touched a drill before. I've never done this stuff before. Of course, it's going to take me time to pick up the skills. And by the end of 4 years, my skills were equivalent to everyone else's. My grades were fine. So, why I didn't have to struggle all those years. Mm-hmm. Thankfully, I had my classmates to help me through. We used to sit in the cafeteria and make fun of our instructors the whole time. But it really shows that, having that bond and connection with others really helps you through hard times. And I'm still friends with them today. So shout out to the class of 99.
It's amazing. No, I agree as well. Dental school is super tough, and it's all about perspective. Like if we change your mind and say this is a learning experience and you're here to make mistakes, because otherwise you would have been dentists already. So the reason you're not is we are here to make mistakes. So and be willing to learn from it. And also that mindset of like everyone, as you were saying earlier, everyone is going to graduate. So really, like everyone at the end of the day is almost the same. So why not enjoy the process? I think is one of the big things that's needed in order to succeed.
Mm-hmm. And it reminds me, I think many students, especially dental students, experience imposter syndrome, and it's important to be patient with ourselves and understand that it's a learning process.
Mm-hmm. I totally agree with that, because I used to think, oh, my instructors are so rude and intimidating. And then the voices in my head were much worse than the things that they were saying to me. Mm-hmm. So yeah, to be kind to yourself.
Oh, nice. Yeah. So next question, Liz is going to ask it for us.
So question 3 is if you could please describe for us your work at a community health center and what it's like providing dental care to children and seniors on public dental programs.
Well, I have the best job. I get to work with kids and seniors all day. I actually, have a huge smile when I go into work. I actually walk down the hallways thinking, am I dreaming? Like, do I really have a job this great? So I love it. So a community health center is a place that provides all different kinds of care: primary care, dietary advice, psychological counseling, chiropody, midwifery, and our health center also has a dental clinic. So we provide care to seniors on the Ontario Seniors Dental Care Program and children on the Healthy Smiles Ontario program. So we are a digital office. We have 5 dentists, 3 hygienists. It's a huge team. And I love working on seniors and children because I find that that's where I can make the most impact. They're willing to, take our advice. They make changes in their oral hygiene routine. They are improving their responsibility for their oral health. And it's just amazing, that they trust us because many of them have never been to the dentist before. And some of them are also new to the country. So language is a barrier. And so there's quite a diversity in the patients that I see, and I learn a lot about them. And as much as they learn about, oral hygiene, I'm learning a lot about them and, their struggles and trying to help them in other ways. So for example, I'm trying to do my best to increase diversity in dentistry, because when kids say something like, hey, I pulled out my own tooth, I'll say, oh my gosh, you can be a dentist, just like me. So, I mean, having an increased diversity, starts at a young age,
Wow.
making them believe that they can actually be a dentist.
So, doctor, did you ever consider specializing in pedodontics, like a pediatric dentistry? Because I know pediatrics is also like about caring for children and also people who are, let's say, elderly, or people that need more attention and special skills to be served. So did you ever consider specializing in it?
No, and the reason why is because when I shadowed at a pediatric dental office after I graduated, I saw that a lot of the kids they were seeing were actually being seen under general anesthesia. And it broke my heart to see these kids just laying there. I had to leave the room and take a breath, because it looked like these kids were dead. And I thought, there's no way that I could do this, because I like working with kids because I like to talk to them and find out more about them and have fun with them. I don't want to see them while they're completely still and asleep.
So do you see yourself like doing all the services that a pediatric dentist can do, but pediatric dentists, all like most of the times, they do it on the general anesthesia case?
Yes. So I take pride in the fact that I have good relationships with my kids, and I'm able to do, non-therapeutic, types of patient management. I just talk to them and get them comfortable with me. So I can do all the treatment, like pulpotomy, stainless steel crowns, all the restorations. Normally I do quadrant dentistry. So in a typical child, I'll do like a sealant on the first molar, and then restorations or pulps and crowns on the primary molars. And they sit there for an hour and let me do it all without any type of sedation.
Wow, that's amazing. Yeah. And I feel like that's one of the good things about general dentistry, because you can do anything. Like it's not restricting. Like you don't need to be a specialist in pediatrics to do certain procedures. I guess except the general anesthesia, everything else is like you can be competent in it. And that comes with more practice and experience, which you're definitely in a great place. So as you were saying, it's very rewarding work. So with the next questions, we are wondering about how is your typical day in the field of dentistry, let's say on a Monday, or like what's your average day? Like, do you go into the office in the morning, see patients first, emergencies, or do you do restorative work, or do you have any schedule to your daily activities?
So I work Monday to Thursday. So 3 of those days I work 8 to 4, and one of those days I work 12 to 8. So most of my appointment times are 1 hour, because I do quadrant dentistry. I mostly do restorations on kids, surgical extractions on the seniors, and then I'm also doing emergencies and recall exams. So it's very similar to working at a private dental office, except we're not doing, cosmetic work and, bridges and orthodontics. So it's very similar.
So you do like surgical extractions for like teeth. Oh, okay, I see. That's amazing. And then for like children, do you like recommend them sort of, I guess a big part of it is also education, right? Like you see about like how to take a better care of teeth, and also the same for seniors.
We actually do that on every single patient, every single appointment. So on the first appointment, we go over every single thing they put in their mouth during the day. And we give them a toothbrush and say, show me how you floss. Give them floss and say, show me if you can do this. And if they can't, we show them in their mouth how they do it. When they come back for their next appointment, I'll say things like, did you brush your teeth this morning? What do you have for breakfast? And then if they had like a sugary cereal, then I'll make some recommendations.
Nice.
So constant oral health promotion. And it's constant praise too. So they'll come in saying, I'm flossing every day now. or, just saying like, wow, look at your teeth. I don't see any plaque on them. You're doing a really good job.
And I know your favorite floss is cocoa floss.
Love all the flavors. So my typical day also involves a lot of reflection, because at the end of the day, what I'll do is, just like in dental school, I'll say, okay, how was my patient management? How was my time management? What went well? What could I have improved on? Notice I said, what could I have improved on, not what went wrong. I think about, how did I interact with the parent, my assistant? Was the patient experience great? So that's like constant growth. So I'd recommend everyone practicing dentistry just like you had an instructor still over your shoulder.
That's a good mindset, but it's so scary though, because you can imagine instructors, they want to get it done on time, and then so it's good because like sometimes that you don't finish, the instructors come sit and finish it for you. But I guess that's not an option.
I wish someone did that for me.
Yeah. So next question, Liz is gonna ask it for us.
So we're curious how your involvement with the Ontario Dental Association began and how it eventually led to your role on the editorial board.
Okay, so this is an interesting story as well, because not only wasn't I an unlikely dental student, I was also an unlikely ODA volunteer. So what happened is, about 5 years after I graduated, the Ontario Dental Association president, Dr. Steve Gorin, just phoned me up one day and said, hey, you're interested in being a volunteer? And my kids were young, and I said, I'm just really busy, juggling work and kids, not now, but later. And I really stuck to that, because in dental school, I was always on class council. I helped organize the International Student Dental Conference. So I know how valuable it is to give back, especially because you learn a lot of skills that you don't learn in school. And it actually helps you become a better person, learning to interact with other people and seeing what's behind the scenes. So when my youngest was 8, I decided to be an ODA committee member, and they have a mentorship committee position where you can just go for a year and see what it's like before you commit to longer. And I loved it so much that now, I went from being a mentor, and now I'm an ODA committee chair of the Community Services Committee. Wow. That year that I joined the ODA, I also joined my local dental association, Halton-Peel Dental Association, and that was fantastic. Most of my friends are from that association. I became president a few years after I joined, and that's where I accomplished my biggest feat, which was delegating to keep fluoride in the water in the region of Peel, because it was being debated. Wow. And my proudest moment was, being in council, delegating to keep fluoride in the water. And afterwards they had a vote, and every single councillor stood up in favor, 100% in favor. Wow. That is so rare.
Yeah. And I know fluoride is such an interesting topic, because every once in a while they want to like get it out of the water, and we as dentists have to step in and really promote all the benefits of fluoride. And especially these days with all the evidence that is coming, like every day you can find these like studies that some of them, they say, oh, it lowers people's IQ, or it affects them. And then we have to be able to sort of analyze the literature and see how grounding it is, and then present it to people and say, no, this study had certain flaws or didn't have certain flaws, and we shouldn't be influenced by it, or we should. And that's a really, I feel like it's a really interesting topic, and that's one of the big things that you did. So for general,
and the way I won over the counselors is I didn't even go into the research, because there's no point, because every time I would pull up evidence saying, it's great, someone else would pull up evidence saying it's not so good. What I did was I shared my experience. I said, I worked in an office where half the people were in a community that had fluoride, half didn't. I didn't even have to look at the address. I could tell just by looking in the patient's mouth who was born with fluoride and who wasn't.
Oh, wow. Yeah. That's a big story. For sure. So yeah, I guess as you were saying, it's all about health education and being able to sort of giving back to your community, and also at the same time improving your skills, becoming a better person, and also having big impacts, like as you said, keeping fluoride in the water. So the next question for us is about resilience. Can you talk about this? Like, has there been any situation in your life that things have been getting tough professionally, and then how did you manage to cope with it, and how did it go? And if you learned anything that you would like to share with us?
Yeah, that's a great question. I know that this question came up because I wrote an article on resilience for the Ontario Dentist Journal, which was in the March edition. And I would also like to highlight the article that both of you wrote on diversity in dentistry, which was in the exact same edition. So if our viewers want to read that, they can go online for the March edition of the Ontario Dentist Journal. So the reason why I wrote that article is because there was a survey of ODA dentists that showed that dentists had moderate stress. So this is during the pandemic, moderate stress, felt overwhelmed, and half of them didn't know how to get help. And I thought, we're hurting. These are my colleagues, my friends, even people outside of dentistry. We're really struggling. So I looked into resilience, and then I mentioned a fable that really encapsulates resilience really well. It's the fable of the oak and the reeds. So the mighty oak used to make fun of the reeds, saying, oh, when the wind comes, you bend over, where I get to stand strong. But then what happened is when a storm came, the oak fell over, bent, and came back. So it just, is an example of, being adaptable. It's not the strongest that survive, it's the ones that can adapt. And we learned that from evolution in biology class as well. So for resilience for me, a few years after I graduated, I was really struggling as a young dentist. I wanted to quit. And then all these horrible things happened to me. Like my in-laws got divorced. My dad got diagnosed with terminal cancer. I became pregnant. I lost my job because I became pregnant. And I was hoping that my son would see my dad before my dad passed away, but my dad passed away, 2 months before my son was born. And so all these horrible things are happening. And then I thought, thinking about my dad's death, I thought, we have no choice in our death. We're all going to die one day, but we do have a choice in the way we want to live. And I want to live with happiness. And I wasn't happy as an associate. So what I did was I looked back into my values. I want to be an educator. Remember, I want to be a university professor. In high school, I was doing advocacy. I was organizing. So I thought, I have to start doing all those things that I enjoy again. So I went into public health. I went into teaching. I went into advocacy and organized dentistry. So then that's when I, had balance and harmony in my life, when I reflected back on my values and made sure I lived my life by them.
Wow, that was a really interesting story. And I feel like reflecting back on values in many times can really put us in the right path, and that's one of the key things that people can consider and see where they are, what are their values, and as you said, it comes all to adapting to the situation and like being able to adapt to it, and then get back on a path that can ultimately make us closer to each our values. And one of the tips I gave with resilience was being connected. So being connected with dentists, especially, or dental students. So that's what you're doing with diversity in dentistry. That makes you happier, having other people who you can share your thoughts with, where you feel seen and heard. Oh, sure. Yeah. And as you were saying, resilience, like the idea of being able to sort of give back to the community the way we are doing, and sort of connecting with people from diverse backgrounds and seeing how different people have made it through life in different ways is really like increasing our perspective and making us better like dentists right now, and also dental students right now, and also be better. As you said, it's all about the perspective and attitude. So that comes to it as well. So next question, Liz is gonna ask it for us.
Great. So Dr. Mohanta, you already shared various challenges that you've experienced, but we're wondering if there are any certain ones you'd like to highlight that you faced along your journey to becoming a dentist, and if you've had any unique experiences in your life in terms of diversity and perhaps within the context of dentistry.
Thank you. So my biggest challenge was myself. Like I said before, having poor confidence, didn't think I was good enough, that I belonged. My other big challenge was finances. When I looked at the tuition for dental school, and back then it was only $10,000 a year, I thought, wow, I can't afford it. So just imagine, because of that number, I almost didn't become a dentist, and I love being a dentist. So just think about all those people who don't even think about being a dentist because of the high tuition. So we're never going to have true diversity in the dental profession when the tuition is that high, because that's like, it's a huge barrier.
For sure.
And, yeah. And when it comes to diversity, I can think of, some things personally, because when my first position as an associate, it was in Pembroke, Ontario, which is a small city in the Ottawa Valley, and most of the residents are white. So I asked the principal dentist if he thought that the patients would feel comfortable having someone like me look after them. And he's like, oh, don't worry. Like, most of the healthcare professions are of various backgrounds. And he was right. I had no problems fitting in, but also it's because I did my best, making sure I was integrated into the community. I used to ride my bike to work. I went to the local library, found an apartment close to the office, found out about all the schools and the teams so I can have conversations with the patients. So of course they're accepting of me because I felt like I fit in and I was accepting of them. And then a few years after that, I had an associateship in West Toronto, near where I live. And it was basically an Indian practice. Most of the staff were Indian, most of the patients were Indian. But I don't speak any Indian languages because my parents came from a state in India where, there are hardly anyone here from there. So they don't speak any of the main languages. So I told her, I said, I don't speak, Hindi, Punjabi, Gujarati, Urdu. Like, I'm worried that I'm not going to be able to communicate with the patients. And she's like, don't worry, English is the main language for business. And here I am with my own community, and I didn't feel like I fit in, but she was right. Most of them spoke English, and most of them didn't judge me or look down on me because I couldn't speak the same language back at them, even though I am Indian, look Indian, but I was speaking English. So there's some, examples of diversity where I was so worried about my own diversity, but patients don't care. They just want, someone who's competent, friendly, treats them well. They don't care about your diversity. And actually, the more you respect them, the more they're going to respect you as well.
Exactly. And I feel like there has been like a survey that's been done in our school. And as you said, like the big things for patients were competency, professionalism, and communication skills, being able to provide all the options, making sure they understand everything. And as long as we have all those, then the patients are really happy. So that's, and also chairside manner, I feel like it's one of the big things. As long as you respect them and you're always nice and you're kind and you're really looking after them, like people easily appreciate it and they lower their guards and they sort of work with you. So that's amazing.
Yeah, it's true. I love it when, the seniors will pat me on the shoulder and say, I think of you like a daughter. And then the kids, are like, can you come to my birthday party? So that's when you know that, you're treating them well.
Yeah, that's so cute.
It's, as you said, being relatable, I think, doesn't have so much to do with necessarily race or language. It really transcends that, and it's just more of a focus on attitude.
Yes.
Sure. So our last question finally is do you have any advice for pre-dental students or for young dentists who are just starting off their careers or they're just debating whether to get into dentistry or not? Do you feel like it's a good time to enter the profession, and any sort of advice that you wish you were given once you're at the beginning of your career or we're just getting into dental school?
So firstly, I think dentistry is a great profession. You can see how happy I'm in it, and there are several paths you can take in dentistry. And with regards to tuition, yes, it's high, but everyone ends up paying off their loan at the end. So don't use that as a deterrent for getting into dental school. And dentistry, the future of dentistry is great. Like, think about the pandemic. People, even though people were scared for their health, scared to go out, they were still coming to the dentist. And there was zero transmission between staff and patients. We're keeping patients safe. Patients still desire to come in. Everyone loves to have a healthy smile, even under the mask. I thought, oh, maybe people won't come in because no one's even seeing each other. No one's seeing anyone's smiles. But instead, they're like, they still really value oral health, and they value us as healthcare professions. Mm-hmm. So healthcare professionals. So I think dentistry is a great career. You'll always do well in it. Mm-hmm. There are plenty of paths to take. There are plenty of ways to be happy. My advice to dental students, pre-dental students, young dentists, is to actually write down why you wanted to become a dentist. Like, put it on your phone in the notes section so you don't lose that. And so when you are a dentist, always go back to those values and make sure that you're following through with them. So for example, if you want to become a dentist because you like doing those huge smile makeovers because you can see how it makes such a difference in the person's self-esteem. Mm-hmm. And then you're looking at what you're doing in dentistry now and you think, okay, I'm just doing some filling, some extractions. I'm not doing any of the things that I really wanted to do. Mm-hmm. And that might mean, going to an area where the patients want that service. Mm-hmm. Another example is maybe you went into dentistry because you liked being your own boss, having that work-life balance. But then you look at yourself and you think, I'm working 6 days a week, evenings and weekends. I don't have time for my family, friends, hobbies. And then you look at your values and I'm like, you're not lining up with what you went into the profession for. So like I said, that when I was unhappy, I looked and I thought, okay, I like to educate. I like to advocate. I like to organize. I like community service. And then I made sure every decision I made followed through with those things. Wow. And that creates harmony.
Wow, that's a really good advice. Like, going back on values is one of the big things, because oftentimes I find it in myself that I'm unhappy, but then I don't really know why. And it's because internally, like subconsciously, I haven't been meeting the goals that I've been setting for myself early on in my profession, in my career. So it all like comes down to reviewing those goals and see where you are. And like trying to go back, getting closer to your values. And even if you don't feel it right away, through time, you feel the impact on yourself, you feel happier. And I feel like it's all those small increments that add up. And I also had a question from you. I guess you talked about pediatric dentistry and you didn't want to specialize. Did you ever want to specialize in any other field? And do you feel like being a general practitioner has ever restricted you from doing a certain procedures that sort of made you more interested in specializing? What's your view on that?
Yeah. I never had an interest in any of the specialties, even though, I really like kids. So people would think I'd go into pedo. I'm in public health, so maybe people thought I'd go into public health. But being a general dentist is diversity. And I love how each day is different. I don't want to see just one group of patients. I like seeing the whole age range, like from beginning doing those baby visit exams to, seniors who are experiencing the golden years of their life. So I like variety. And so that is why I like general dentistry. I never felt restricted. I like the partnerships I have with a specialist where I can refer and talk about cases and make sure that the patient gets the best care.
Mhm.
So, I applaud the people who go into specialty programs because we really need them. But for me personally, I love being a general dentist.
Oh, awesome. And yeah, that's really great to hear. So, Liz, do you have anything to add or any questions you would like to
But
add?
I'd like to thank you so much, Dr. Mohanta, for joining us. Your advice at the end definitely really resonated with me, and I'm going to get on my phone and write down my values.
And we
All winners here. I love seeing Harvey. And best of luck to both of you, Rose Bay and Lise. You're going to be fantastic dentists. Like, look what you're doing for, your colleagues just now as dental students. I just can't imagine what you're going to do for the profession and the public as dentists. So way to go.
awesome. And we will definitely be in touch during our journeys because we both have a lot to learn from you, and we would love to be mentored by you. So we will send you an email
Yes,
once in a while,
definitely.
keep you updated about our journey, how things are going. So that's really awesome. Thank you.
And for any of the viewers who want to contact me, you can reach out to me on Instagram at Dr. Sanj Mohanta. I'd love to mentor anyone who wants some advice.
Awesome. Thank you so much. And have a great day. Thank you so much.
You too.